Well, hey, Dr. Palmer, it's good to see you, and thank you for carving out the time to chat with me and share your wisdom and experience with my audience.
Thank you for having me on.
And for the folks who are listening, I'll share a little bit of background on Dr. Palmer. He's the director of the Department of Postgraduate and Continuing Education at McLean Hospital and an assistant professor of psychiatry at Harvard Medical School. I'm sure you've heard of that before. His psychiatric clinical practice is focused on treatment-resistant cases for over 20 years using psychopharmacology, psychotherapy, and complementary and alternative treatments, which is going to be something that we really focus on in our discussion. Most recently, he's doing research on the interface of psychiatric disorders and metabolic disorders, things like obesity, diabetes, cardiovascular disease, and inflammation, in order to better understand what is causing mental illness and to develop more effective treatments. Specifically, he's pioneering the use of the ketogenic diet in psychiatry based on his own experience treating patients, as well as the research he's conducted that has shown the profound effects on the brain, neurotransmitter levels, and inflammation. Last but not least, he's written a really interesting book called Brain Energy. That's the reason that I really wanted to connect with Dr. Palmer. It's a fascinating book, and it's one of the first that I've seen that draws a very clear connection between what I would say is just the way we're living, our lifestyle choices, our habits with respect to food in particular, and the connection between our and what that does to our mental health. So anyhow, the book is Brain Energy. I'll put more information for that book as well as for Dr. Palmer in the show notes. That's Dr. Palmer. Anything else that you'd like to add?
No, that's more than enough.
One place I'd like to start is actually with the story of Tom that comes from the introduction in your book. He was a patient of yours in 2016. Can you tell me about Tom, about this experience and how it sort of started to point you in this direction, at least more deeply in terms of the research around metabolic health?
Yeah. So Tom was at that point in time was the 33-year-old man diagnosed with schizoaffective disorder. For those of you who don't know, that's kind of a cross between schizophrenia and bipolar disorder. He had daily hallucinations and delusions. He could barely leave his home or apartment. He was very paranoid that people were out to get him. People were talking about him. He couldn't go out in public without being terrified. And had tried 17 different medications at that point, and none of them stopped his symptoms. They sedated him, they reduced his anxiety, but he was still suffering from daily hallucinations and delusions, was gaining massive amounts of weight, and essentially his mental illness ruined his life. It ruined his life for all intents and purposes. And for any of you who aren't familiar with the diagnosis of schizoaffective disorder, he is typical. That is what happens to people with that diagnosis. The overwhelming majority of them do not get better. They are tormented by their symptoms. The medications and treatments that we offer might reduce symptoms at best. People develop all sorts of health consequences. So he was not in any way unusual or out of the ordinary. And for whatever reason, he got it in his head that he wanted to lose some weight because he really wanted to get a girlfriend. And he recognized that he had all sorts of problems with himself and his life, but one of them was being overweight. And that was something that maybe he would try to do something about. So he asked for my help to lose weight. For a variety of reasons, we ended up deciding to try the ketogenic diet. And within 2 weeks, not only did he start losing weight, but I began to notice a powerful antidepressant effect in him. And the most astonishing thing, the thing that just upended everything that I knew as a psychiatrist, about 2 months in, he spontaneously reported that his long-standing hallucinations were beginning to go away and that his paranoid delusions were also starting to go away. He began to realize they weren't true and probably never had been. He's now lost over 160 pounds and has kept it off to this day, over 6 years later, but was able to do things he had not been able to do since the time of his diagnosis. He could start going out in public without being paranoid. He was able to complete a certificate program, has been able to teach karate classes, was able to move out of his father's home for a period of time. And that kind of shattered everything that I knew about schizophrenia, bipolar disorder. How on earth could a diet improve somebody's symptoms so much? And so I went on a journey to understand what on earth just happened.
And when you say you went on a journey, I imagine that at first, one of the things you did was went to some other trusted sources and said, "Hey, here's what's going on. Can somebody, are there any priors or where should I research?" What was the reaction or the response from those that you immediately shared these insights with? And how did the journey unfold from there?
There were a couple of colleagues that I did talk to about this. One in particular who was involved in this particular man's care. And they were all equally just dumbfounded. They had no idea what was happening. The good news is that the psychologist who was working with me on this case was also seeing the exact same improvement. So, because I was kind of questioning, am I seeing something that isn't there? Like, this is impossible to believe. And I'm really having a hard time understanding this. So, he was able to see it. The patient's father was able to see it. There was another clinician involved who was able to see it, but nobody understood at all what was going on. And so I actually had to turn to the medical literature to figure it out on my own. And, I knew the ketogenic diet as a diet for weight loss. And I also knew it as something that was really helpful for metabolic syndrome, meaning blood pressure, diabetes, cholesterol, and also type 2 diabetes. I knew that it was used for all of those things. But unbeknownst to me at that time, I had no idea it's a 100-year-old evidence-based treatment for epilepsy. The ketogenic diet can stop seizures, even when medications fail to. And that was a really important clue because it turns out we use epilepsy treatments in psychiatry all the time in millions of people. And we often use them off-label. It also turns out we've got decades of neuroscience research on this diet telling us what it's doing to the brain and how it stops seizures. And most of those mechanisms of action are highly relevant to people with serious mental illness. And that is, in fact, why there's so much overlap in the treatments, is that we use epilepsy treatments because those same mechanisms of action, changes in neurotransmitters, changes in brain inflammation, changes in calcium signaling, all sorts of things are highly relevant for both epilepsy and mental illness. So to set the stage at this point, now I've used this treatment in dozens of patients, and I've seen nothing short of miraculous results in many of them. People with schizophrenia, bipolar disorder are putting their illnesses into full and lasting remission, sometimes off of medications. We've actually now got probably about 5 to 10 research trials underway from world-leading psychiatrists and neuroscientists. So people are extraordinarily excited and enthusiastic about all of this.
Yeah. So I've got one question I'll try and hold on to for later, which is building off of what you just said. Is I really want to pick your brain on what excites you that's on the frontier of research in this area of, I guess, what you'd call metabolic psychiatry, and what the ideal model of care looks like from your perspective. So I'd love to get to that a little bit later. But for now, can you say more specifically about the role of mitochondria? Sort of walk through the mechanisms that are at play when it comes to the ketogenic diet in particular, and what you guys believe is actually happening in the brain and the body.
That was one of the most important clues to me, is I was trying to understand the specific mechanisms of action and how does a diet change neurotransmitters? How does a diet change calcium signaling? How does a diet reduce inflammation? Like, how can I connect these dots? Time after time led to these tiny things in our cells called mitochondria. And so most people know mitochondria as the powerhouse of the cell. And that means they take food and oxygen and they turn it into ATP, which is the energy currency of cells. And in fact, they are so much more than that. Research over the last 20 years in particular has exploded on mitochondria and all of their functions. And in fact, they play a critical role in how the human body functions. Bottom line, if you ask somebody, like, how does the human body function? What's controlling everything? Some people might say the brain, but in fact, the brain isn't. The brain is playing an instrumental role, in controlling different aspects of bodily function. But on its own, it isn't the primary source of control. Other people might say it's our DNA, it's our genetics. And actually, that's not at all correct. If you actually look at the science, if you look at the research, we mapped the human genome over 20 years ago with the assumption that we would understand how the human body works if we just understood the human genome. And what we now know, after having this information for over 20 years with some of the best researchers on the job, at least billions, probably trillions of dollars spent on research in this area, when you look at the conclusions, it's not DNA. DNA is not the primary thing controlling the human body. In fact, it is mitochondria. Mitochondria are sensing our environment. They create signals that communicate with our DNA. In terms of the mental health field, they are pivotal and critical to understanding what causes mental illness. They play a direct role in neurotransmitter production and regulation, including neurotransmitters like dopamine and serotonin and GABA and glutamate. They play a role in hormone production and regulation, things like cortisol and estrogen and testosterone. They play a role in turning inflammation both on and off. They also play a role in psychological and social factors. The human stress response, psychological stress, is mediated through mitochondria primarily. I mean, it's obviously complicated. There are hormonal changes. There are nervous system changes, changes in inflammation. But when you look at how do all of those connect, what exactly is controlling these things, you end up at mitochondria once again. And so mitochondria are basically a new way to understand the human body, understand what causes it to work and how it functions. But they also can help us understand what can cause the human body, including the human brain, to malfunction. And at the end of the day, that is what mental illness is. Mental illness represents the brain malfunction.
I see. And so maybe as an analogy, you can think of the mitochondria as playing this central role in this incredibly complex symphony that's happening in the body. And maybe the mitochondria is the conductor in a sense, or at least one of the major players. When somebody is in ketosis under the ketogenic diet, is it that the body is in some sense believing that it's at or near a point of calorie deficit or starvation, and that as part of that complex symphony, there's this interplay between that perceived state of starvation and then a direct interface with the mitochondria? Like, can you speak to that part of this process in terms of what the mitochondria is sort of being keyed off to?
So the ketogenic diet kind of mimics the fasting state. And so most people think of fasting as a bad thing. It's technically going without food. And most people usually think going without food equals starvation, which is death. And that is a very bad thing. And in fact, yes, if taken to extremes, it is a bad thing. Starvation is horrible. Humans die of it all the time. And certainly throughout history, we have seen, plagues of famine and drought and other things that decimate populations due to starvation. But going for short periods of time without food is called fasting. And that actually has tremendously beneficial effects on the human body, including the human brain. And many of those effects are mediated through processes called autophagy, which is basically where our cells will get rid of older defective proteins or parts and replace them with new ones when we start eating again. But as part of that process, mitochondria are included. So the fasting or fasting mimicking diets like the ketogenic diet stimulate two processes that are central to mitochondria. They stimulate something called mitophagy, which is mitochondrial repair, getting rid of older defective mitochondria and replacing them with new ones. It also stimulates something called mitochondrial biogenesis, or the production of new mitochondria. And because mitochondria are so central to the way the human body and human cells function, it is actually really beneficial to kind of put your body through this cleanse, if you will, where the body will get rid of older defective mitochondria and generate new healthy ones. And that can have tremendous healing properties. And in fact, it is not a coincidence that fasting has been used by medical professionals or medicine men or spiritual healers, but also in every religion on the planet for millennia. All cultures have used fasting for healing purposes. It's not because those people were all stupid, primitive quacks. It's because they actually were observing a real thing. It really actually works. And we now have the science to demonstrate precisely how and why it works. Those people weren't stupid religious fanatics. They were actually noticing real benefits. Now, they attributed those benefits to God healing, and some will disagree with that kind of interpretation. The scientists of this day can actually put science to it now and explain how exactly that works. And for those of you who believe in God, maybe God planned it that way and designed the human body to heal when fasting. So not that those have to be mutually exclusive concepts, but whether you believe in the religious purpose of it or whether you believe in the scientific understanding, either way, healing is going on. And that is an amazing thing.
Yeah, if you apply it and you get the benefits, whatever the sort of symbolism is to you, it doesn't really matter at that. It's fascinating. Yeah, and another great example of, I don't want to say cliche saying, but what's old is new. You know, we're finding so many instances in which, call it ancient or indigenous practices and wisdom, they didn't have the scientific method, as you pointed out, to identify and isolate all the individual variables at play, but certainly through the powers of acute observation and a lot of trial and error, they had identified ways of caring for themselves and healing that now the scientific literature is able to say, yes, this is what it's doing. This is the rough magnitude of it. And here are the mechanisms that it's acting. It's all very interesting. I see that with heat and cold exposure in these older civilizations and cultures that use that as a common part of their health practice. I actually go to a nearby gym where there's some Russian gentlemen who I swear they'll spend 2 hours in the sauna every day. And then whenever they get the chance, they go to the coldest lake they can find. And to some extent, this is also happening in the world of psychedelic medicines as those are being researched and explored again. But anyhow, what's old is new and time is a flat circle in a sense.
Yeah.
One of the things that you had mentioned earlier when talking about Tom's case was in some cases, patients are able to come off of medication entirely. I'm sure there are cases where it's the combination of pretty radical shifts in their diet towards something that is akin to ketogenic, is then complemented potentially with a lower dose of medication. Can you speak a little bit more about what you're seeing in terms of the interplay between the shift towards a ketogenic diet and what that does to the medication needs of one of your patients?
So, psychotropic medications are complicated, but at the end of the day, I actually think they can primarily be broken into two buckets. And the two buckets are, we have lots of medications that increase metabolism or metabolic rate or improve mitochondrial function, at least in the short run. And those include many antidepressants. They include stimulants, thyroid hormones commonly used, even electroconvulsive therapy and TMS are stimulating brain regions.
And transcranial magnetic stimulation, is that? Yeah, okay.
Yes. I mean, even ketamine has been linked directly to mitochondrial function and stimulating mitochondrial function. And so, lots of treatments are stimulating metabolism, stimulating mitochondria, and that is probably how and why they are working to relieve mental illness. The paradox is that a lot of psychiatric medications, though, do the exact opposite. They suppress metabolism or impair metabolism. And for people who've taken psychotropic medications, many of you probably already know this. What does that mean? That means they cause weight gain. They can cause type 2 diabetes. They can cause an increase in risk for cardiovascular disease, meaning your lipids can get worse, your blood pressure can go up. And in fact, people can have premature heart attacks or strokes. And in the elderly, at least, it is well established by the FDA that they can cause premature mortality. So those are all signs and symptoms of a substance that is impairing mitochondrial function or impairing metabolism. And in many ways, it's important to think through what medications a person's on and what effects or impacts are those having on that person and their brain and their body. And what are we trying to accomplish? So, in a lot of ways, the ketogenic diet is trying to do the opposite of what some antipsychotics are doing in terms of antipsychotics that cause type 2 diabetes, that cause massive amounts of weight gain. Ketogenic diet is trying to do the opposite of that in order to heal. And so some medications may actually interfere with people's ability to heal. The challenge with psychiatric medications, for any of you who are familiar with this, is that they are not easy to get off of, and they can be quite dangerous. So I strongly recommend, and in fact, if you're going to listen to me, I insist that you work with a mental health professional to get off your medications. It is not safe to do it on your own. I have seen people become psychotic, manic, depressed, suicidal, and some people end up dead because they try to stop their meds too fast. Some people end up arrested. Other people end up in psychiatric hospitals. It is quite dangerous to try to take matters into your own hands. So I do not recommend that at all.
What you just shared, it really speaks to, I think, one of my favorite sections in your book where you spoke about the immense heterogeneity of the human population. And I really love that chapter because, for me in my own personal journey towards mental wellness, one of the major conclusions that I've come away with is that the individual has to find what works for them, and that there may be these boilerplate things that are generally applicable to anyone who's trying to improve their mental wellness, such as diet, sleep, exercise. But then beyond that, it gets incredibly nuanced and very individualized. And in this section of your book, you also spoke about how that heterogeneity makes it very difficult to successfully sort of treat patients at scale, find these consistent systems that work from one person to the next, and also to be able to, I guess, sort of generalize what the DSM now does in terms of trying to bucket people into different categories based on a collection of symptoms. And so I guess the question I would love to ask is, you're making a very strong case that yes, medication is important. You should work with a professional, but it comes with this nuance that it also comes with potential downside risks, and those must be managed at the level of the individual. And so when you think about how we're treating patients today, even using the example earlier where you mentioned with Tom of, somebody might have been on 17 different medications. What do you see as the evolution or your ideal evolution of how we think about and categorize different types of mental illness and how we treat people given the immense heterogeneity of people?
In some ways, DSM makes sense. Most people know what the labels mean, but if you actually do a deep dive into the science, or you listen to world-renowned scientific leaders like Tom Insel and lots of others, lots of researchers at the National Institute of Mental Health, DSM is not valid. The labels that we use to describe mental illnesses are simply syndromes. And so this includes schizophrenia and bipolar disorder, and even alcoholism or alcohol use disorder, depression. The symptoms are real. The suffering is real. The devastation to people's lives is real, but those labels are not valid disease constructs. That is what all of the science for decades has been telling us over and over and over again. Even the genetic research. Most people think, well, those things are genetic. There must be a schizophrenia gene. Guess what, folks? We have looked high and low for that schizophrenia gene, or even the 10 schizophrenia genes. And guess what? Not there. They're not there. The same genes that confer risk for schizophrenia also confer risk for autism and bipolar disorder and depression and epilepsy and other diagnoses. So I think the first step in understanding the complexity of mental illness is to understand that although the symptoms can be wildly different from person to person, one person could be depressed, another might have obsessions and compulsions, another person might have hallucinations and delusions, another person might have distorted body image and think that she is, when in fact she is starving to death. Those are very different symptoms. And yet if you look at the root causes for any one of them, they overlap among all of them. And so one of the things that we have to work toward as a field is getting rid of our invalid diagnostic categories. They're not valid constructs. We need to embrace that, recognize that, and move on from it if we're ever going to advance the mental health field. The longer we cling to things that we now know are not true, the harder it's going to be to actually make any progress. The beautiful thing about the brain energy theory is that it suggests that all mental disorders are simply metabolic disorders of the brain. And that means that there are lots of treatments that are going to overlap. Yes, people with psychotic symptoms might need different treatments than people with depression, who might need different treatments than people with alcoholism. But in fact, there's going to be a lot of overlap between how to treat those individuals, because at the end of the day, their brains are all metabolically compromised. It's that simple. So in a way, this theory allows us to embrace the heterogeneity or the differences among people, the individuality among people, but it also helps simplify that heterogeneity. It helps us understand it, and it helps us with concrete solutions that are going to apply to a wide range of diagnostic labels.
Yeah, and it's consistent with my experience as, call it a mental health patient, where there was a point in time where I went through a period of taking the typical diagnostic exams. For example, I think it was called the CAPS-5, which is for measuring and understanding the PTSD symptoms in somebody. And so I went through all these diagnostics, and at the end of it, they said, okay, you have complex PTSD, you have obsessive compulsive disorder. And I said, oh, yeah, that I could have told you. And generalized anxiety and dysthymia, which is, just a tendency towards generally a lower mood or lower states, mildly depressed. And my reaction as a patient was, Jesus, it's a lot of letters you just, it's like, did I just earn a PhD in being unwell is kind of what it felt like. And so for me, my experience as a patient was that these diagnostic labels weren't particularly informative, other than saying, this is what these conditions imply in terms of a collection of symptoms. I said, okay, that makes sense. That's helpful to sort of identify these collection of symptoms. But otherwise, beyond that, as somebody, sitting in the chair, as far as I can tell, those labels really just played a role in trying to get insurance to cover some of my treatment. And beyond that, I wasn't able to identify any other benefit. Instead, I've either experienced myself or have witnessed through folks that have reached out to me because of my writing on mental health, where their experience has been that they then over-identified with those labels and started to speak of themselves like, I have PTSD or I am OCD. And then they attach so closely to those labels that itself is at least potentially a problem. I don't know. It's almost like it created a unique form of some sort of cognitive dissonance where then they so attach themselves to the labels that it's as if they needed to work through that to free themselves of the label and realize that this isn't a death sentence, basically, right?
And the reality is that, at least with some of the psychiatric labels that we assign, we really do tell people this is a lifelong label that you need to embrace. Bipolar disorder, you're never getting rid of it. Schizophrenia, you're never getting rid of it. Chronic depression, you're probably never going to get rid of it. OCD, yeah, maybe it'll go away with good treatment, but if you look at the study outcomes, you're probably going to have OCD the rest of your life. Complex PTSD, you can, if you do trauma therapy, that'll help you out. Again, if you look at the treatment outcomes for the studies, it's not so great. And so our field actually encourages people to just accept second-class status in life. That is what our field is doing. We are telling people you're bipolar. Accept it. Accept all of the limitations that comes with it. Accept all of the side effects and consequences of the treatments that we are going to deliver to you. Just accept that you are going to live a second-class life. And what the brain energy theory says is that is not at all scientifically true, accurate, or valid. It is not. If you actually do your own research, if you look up the scientific studies, that is not at all true. This is a new day in the mental health field. This is hope. This is about empowering people to get better, empowering people to figure out what will work for you, what are you capable of doing, and how to heal yourself, how to move beyond these labels that enslave people for life.
Yeah, and that's the analogy I was given, as well as many other people I know, is they say, well, there's no cure for this, but you can control it, you can manage it. So think of this like you have diabetes. And if you have, certain structures and a lifestyle in place, you can manage your mental diabetes, right? That was exactly what I was told. When you're already in a funky place, and then when a doctor says, you're going to have this forever, it's like, fuck. Excuse my French, but that's what it feels like. Not particularly helpful either.
No. And I would argue, based on the patients that I am seeing, this is not speculation. This is real life. Today, in 2023, I am seeing people put these labels behind them and live happy, full, productive lives. They are working full time for the first time in years sometimes. They are having relationships. They are getting married. They are moving on with their life. This is about empowerment.
It's fantastic. Again, it's one of the reasons why I'm so excited about the book and the research that your team is doing. And I think there's a few other universities in the US, at least, that are trying to conduct similar metabolic related research. And it just feels like we're on the cusp of this radical shift in how we're thinking about and treating mental illness, which gets me excited. And related to that, so for the folks who are listening, who are then thinking, okay, how do I apply this to myself day to day? Let's imagine that I'm one of your patients and I'm saying, okay, great, I'm on board. How do I get started? What is the guidance that you give to folks?
I really think it depends on how serious of a disorder you have. So if you have a disorder that results in symptoms that are dangerous or life-threatening, and that would include suicidality, that would include severe crippling depression, this would include a severe eating disorder or substance use disorder, and it would include hallucinations and delusion. If you fall in one of those categories, I really want you to get professional help. Because just because I'm telling you, you can move on, you can get better, you can heal, doesn't mean it's going to be simple, and certainly doesn't mean it's going to be immediately safe. By the way I just defined that, you are currently potentially unsafe based on your current symptoms. You deserve competent medical help. because you've got a brain disorder, a metabolic brain disorder. That's a real thing. So it's not that I'm saying everybody go out and clean up your diet and go walk around the block a few times and that's going to snap you out of your schizophrenia. I'm not in fantasy land, folks. These are still serious brain disorders. They still deserve competent medical care. They really do. So for the people in those camps, I'm going to say you need to find a mental health professional or a medical professional who's going to work with you and do this. The reality is I already know it's going to be frustrating for you because there aren't enough medical or mental health professionals yet who are doing these treatments. So that is part of the frustration and the pain point right now, is that I really firmly believe we need a grassroots movement to make the real change, to start demanding these treatments, to get the mental health profession to start responding and training people in these treatments. And that is happening. I am delighted to say I'm being invited to speak at conferences. I'm being invited by young psychiatry residents to come and give presentations to them. So it is starting. But I single-handedly cannot change the mental health field. I'll be the first to say it. If people aren't willing to get involved, if people aren't willing to learn enough of this science and do something about this, nothing's going to change. You're going to go on with your diagnostic label. You're going to go on with the treatments that may or may not be working for you. And you're going to live your second-class lives. And that's just the sad reality. And obviously, that's heartbreaking and frustrating for me, but that is the truth. So we need people to actually get involved. We need people to step up now, today, start doing things. For people who don't have serious mental disorders, people who don't have serious, dangerous, life-threatening symptoms or situations, I think they could read the book or sign up for the newsletter, learn enough about this theory that I really do want you to understand everything that's involved, because it's not as simple as go out and do the keto diet and that'll fix you up. That's not what this is about. This is about understanding all of the different factors that influence metabolism and then taking steps to address those things to improve your metabolic health, to start your healing journey. It's similar to if somebody has a broken leg, the leg was shattered, let's say, they got run over by a car, shattered leg, been in a cast for 4 months. And that person says, I want to be able to run again. I'm not going to tell that person it's impossible. I'm actually going to encourage that person to, well, yeah, let's do a program. Let's get you running again. But I don't have like a really simple, okay, here are the 2 steps that you need to do to be running again.
Yeah.
Now, does that mean it's impossible? No. Any of you could probably help figure out that program for this person. Like, we're going to take it slow. Let's get the cast off first. Let's work on walking first. Let's start to build up some strength. If it starts hurting too much, stop doing whatever you're doing. Take it slower. Like, that is the path to this person being able to run again. So do I have a one-size-fits-all solution for everybody who's got a cast on their leg who wants to be able to run? No, I don't. Does that mean it's impossible? No. Does that mean it's too wildly complicated for anybody to figure out? No. This is common sense stuff, folks. But I need you to figure it out for yourself. I need you to understand the basics and then do a plan, like do a treatment plan. So this means if you're not sleeping, diet is not going to be helpful if you're not sleeping. So I need to mention sleep. If you're using a lot of drugs and alcohol, that's not good for your brain. Sorry to break the news to you, but drugs and alcohol are not really good for your brain. I'm really sorry, but they're just not. And so if you're doing lots of drugs and alcohol, the keto diet's not going to fix you up.
Right.
It's just not. You're going to have to get off the drugs and alcohol. Now, is that super complicated? No, it's kind of common sense. Everybody knows it. And yet, if I tell people go out and do the keto diet and I don't mention all of these other common sense things, treatments aren't going to work. So the easiest solution, read the book, understand the basics, understand how to put together a treatment plan for yourself. Again, not rocket science, folks, not rocket science stuff, but there are a lot of factors to consider. Put together a plan for yourself and then slowly but surely work toward that plan. Just like the person with the cast on who wants to run again. There's no overnight fix. I don't have a quick overnight fix for that person. But I don't want anybody telling that person, you're never going to run again. Wow, you've got a really bad leg. Just give up on ever walking even. You've got a bad leg. Just like, let's just forget about you ever walking and let alone running again. Like that's impossible. It's not impossible, but it's going to take some work. It's going to take some time. It's going to take some dedication. Not always going to be easy. There will be setbacks along the way. That's okay. You'll start running and it'll hurt a lot. You might even re-fracture a part of that fractured, that shattered leg. It's okay. It's okay if that happens.
Yeah.
That's part of the healing journey. Unless you want to just remain disabled the rest of your life and never walking or running again, that's part of the healing. And this is the way it is with brain health too. It's a journey. It's a process. There are going to be ups and downs. There might be occasional setbacks. That's okay. We're not going to freak out. We're not going to give up. We're not going to get all hopeless. We're going to stay on the path until you recover, until you have the life that you want.
Yeah. It's a fantastically exciting and positive message in a world where, coming from the patient's perspective, so much of the information that's put out there is sort of doom and gloom. So yeah, thank you for that. The enthusiasm
Absolutely.
is there. And, we're seeing the potential for mass mobilization in the psychedelic world, where there are organizations like MAPS that are working earnestly to try and train 5,000-10,000 clinicians over the next decade to become familiar with the potential for these psychedelic substances to be used in a clinical setting. And that is at least I would imagine, a much, much higher hurdle to overcome from a regulatory standpoint, from probably a scientific perspective, in the amount of studies and the complexity involved there with the various substances and the different methods and approaches. Nonetheless, it's happening. It's happening. It's taken decades, but it's happening. And so I look at this and I say, okay, if this is the introduction of the understanding of metabolic health and the interplay between our sleep, our diet, what we consume, and how the brain functions, and consequently how we can change our lives and live, like, the potential for this magnitude of mobilization is absolutely there. And so I fully endorse that. Hopefully we can make that happen. And related to that, if you were to, let's go tabula rasa, you got a blank slate, and you could suspend reality for a while and just say, this is the ideal model of care that I imagine in the future, and how the process of psychiatry and therapy sort of unfolds in a different way. Like, what does that ideal look like from your perspective? What is the dream or the vision that you have?
I think part of the dream and vision includes prevention strategies. So early identification and prevention. And we already have existing data of the connection between metabolism or poor metabolic health and subsequent diagnoses like bipolar disorder, depression, and even schizophrenia. So insulin resistance, for instance, 9-year-olds who had the highest levels of insulin resistance had a 5-fold increased risk for developing bipolar disorder or schizophrenia. 5-fold, 500% increased risk. We can identify that today in 2023. We could do something about it. Usually it's about a change in diet and a change in exercise. If we change those two things, diet and exercise, we can address insulin resistance without the use of pills. At the same time that we're preventing possible new cases of bipolar disorder and schizophrenia, we're also preventing obesity. We're preventing type 2 diabetes. We're preventing premature heart disease. So this is about human health, which includes brain health. These aren't isolated treatments to brain health. So one of the exciting things about this is that a lot of these treatments are no-brainers. They're not going to bankrupt our healthcare system. They're actually going to save our healthcare system money. Because at the same time we're improving brain health, we're improving physical health. These people are going to be happier, healthier, live longer, be more productive in their jobs. It is an obvious no-brainer. So I want comprehensive health prevention strategies from your doctor. Instead of your doctor only worrying about what pill do I need to give you for the condition that you have now developed, I want your doctor, starting with pediatricians, to be thinking about where are the warning signs in this person and how can I help this person prevent a worse outcome 5 years down the line? What can we do? And so I want multidisciplinary treatment teams, because the pediatrician having a 15-minute visit with you once every year is not going to be enough time, and it's not going to be enough support and education for you to do what you need to do. So we're going to need psychotherapists, health and wellness coaches, fitness trainers, others who are all going to be part of your medical treatment team. And when needed, when indicated, insurance is going to cover these treatments. Why? Because they're going to save so much money. It's going to save so much money in the end. It is going to be a lot cheaper for 1 year to pay for a fitness trainer and a health and wellness coach than it will be to pay for a lifetime of antipsychotic and mood stabilizing medications, let alone all the obesity treatment and the heart disease treatment and the diabetes treatment and everything else that's going into that person's healthcare dollars. We're going to save so much money, but yes, there's going to have to be some investment in people's health. The real sad reality is that even if I got my vision of everything I wanted, I'm well aware that we're not going to prevent all mental illness. Trauma is still going to happen. Wars are still going to occur. Those things contribute to the development of mental illness, at least in some people. So fully preventing mental illness would require the human species to evolve and become utopian. No more war, no more poverty, no more injustice in the world. Everybody's safe and secure and feels respected. Unfortunately, I don't think I'm going to see that in my lifetime. But nonetheless, as those things are happening to human beings, we can intervene. We can help them. We can help them recover. We can get them out of those unsafe environments. We can help them heal and recover using traditional mental health treatments, but also enhancing it with these newer metabolic treatment strategies. And I really authentically believe, instead of assigning people these lifelong labels and telling them you're going to have this forever, instead of telling people there are no cures for mental illness, we start telling people you can recover. Just like the person with the shattered leg, telling that person you'll never run again. We don't know how to get people like you to run again. That needs to change. We need to empower people. We need to motivate and inspire them and let them know it is possible for you to run again. And what I'm saying is, even if you have been diagnosed with a very serious mental health disorder, a brain disorder, what I'm telling you is it is possible for your brain to heal, and that we can, in fact, use strategies even today to help you get better. Part of my big vision is that I want more resources going toward mental health. Our research funding is abysmal for mental health. Right? I think it accounts for about 4% of the global healthcare research dollars. 4%. Even though mental disorders are the leading cause of disability on our planet, they are the leading cause of suffering on our planet. And we're only spending 4% of our research dollars on this. That needs to change. People getting access to quality care, that needs to change. So many people can't get mental health treatment. If you do get mental health treatment, most people have to pay out of pocket for it. The psychiatrist or the therapist won't take your insurance, so you got to pay cash. And that means you got to have that cash to be able to get that treatment. And a lot of people don't have that kind of cash. And that's really unfair. And it's not a just system. And it's certainly not a medical model system. All of this needs to change. So we need big changes. But although that's grandiose, it's worth it. If you or anyone you know has a serious mental illness, you know it's worth it. It would be worth it for you to get your brain back. It would be worth it for you to have a new life. It would be worth it for you to be able to go back to work. It would be worth it for you to not suffer so much. We need to change it.
Yeah. Yeah, we do. I mean, the rate at which the American population is experiencing depression, anxiety, and other forms or other symptoms is staggering. Something has to change. And it's got to be a concerted, multidisciplinary effort. And the introduction of this wisdom and knowledge back into the family doctor, back into the training and the development of new psychologists and new psychiatrists. Again, it's all possible. And you're definitely leading the charge on that. And I guess let's lean a little bit more into that direction is what research are you most excited about that's on the horizon? What studies you really want to see moved forward? Because potentially there's some folks who are going to listen to this that you never know, might be able to help out in one way or another.
So the great news is, at least through philanthropy and a dedicated system, we really do have kind of an international cohort of leading psychiatrists, neuroscientists, all pursuing research on the ketogenic diet in particular as a treatment for serious mental illness. So for those of you who don't know, this theory doesn't come from thin air. This theory is actually based on decades and decades of research from leading psychiatrists, neuroscientists, metabolic researchers, and others. So those people will continue to do their research. But like I said, I would love to see more funding go their way so that we can make more rapid advances. The research that I would most like to see, though, would be research, this multifaceted, individualized or customized treatment planning. It's harder to study. It's hard to get funding for that kind of a study. What I'm saying is I want you to give me 500 people diagnosed with schizophrenia, and I want to work to get them all better, but they might all need slightly customized treatment plans. If some of them are smoking cessation is going to be part of their treatment plan. If they're not smoking, that's not going to be a part of their treatment. If they're on lots of medications, part of their treatment might be to slowly but surely, safely wean them off as much of that medication as possible. Other people may not be part of their treatment. Some people might do well with a ketogenic diet. Others might do well with exercise. Others might do well with stress reduction. Again, these aren't rocket science things. So I would love to see some research studies where clinicians and researchers are able to customize the treatment plan. And yes, we will document it and we'll analyze it and we'll figure out what were the key variables. I authentically think those studies have a chance of demonstrating what I am asserting, which is people that we currently label as schizophrenic or bipolar or chronically depressed or OCD. People who have those labels and we're telling them this is a lifelong disorder. I want to first and foremost demonstrate that is incorrect. That is not true. We can actually get these people better. Even if it has to be a customized, individualized treatment plan, we can do that. And I think once we do that, then it opens up a whole new way to think about it. Because again, at the same time, we're improving mental health. We're also improving physical health. We're improving capacity to function in society. We're improving so many things that although it might be a slightly more complex or even possibly a more expensive treatment in year one, it's a treatment that comes with the hope of remission of illness. And that means no treatment in year through 20 or minimal treatment in year 2 through 20, where we're just monitoring people or supporting their efforts to stay in remission. And I would love to see those kind of studies done.
Yeah, me too. Me too. And this is one of the things I got from your book is, although the ketogenic diet is sort of the prime subject subject that's being studied. I'm sure there are cases where just getting off of processed foods and getting into a healthy diet, even if that's, in some cases, I would imagine it'll be the path of becoming vegan for some folks, and that does the trick. For others, there are a lot of anecdotes, and there still needs to be a lot of research on this, but there's some folks that go the carnivore path, and it's life-changing for them. And so again, at the end of the day, you have this immense heterogeneity. It comes down to the treatment of the individual and working with a competent professional, along with the individual being bought in to say, let me find what works for me.
And interestingly, psychedelics fall into this as well as possible treatment options. Ketamine does. But even what you were mentioning, and cold treatment. Hot and cold treatments are all about metabolism. That's what they're influencing. Cold is stimulating mitochondria to produce heat. And that is the primary mechanism of cold exposure or cold swimming or diving, cold showers, any of that. So I would love to see those types of interventions included in all of this.
Yeah, and it all falls into the category of root cause treatments, as opposed to let's address the symptoms. These are root cause things. That's what excites me so much, being on the receiving end of this knowledge. Dr. Palmer, I really appreciate it. I've taken an hour and 4 minutes of your time. I want to give you your time back so that you can go on doing the great work that you're doing. But thank you again for spending the time with me.
Absolutely. Thanks for having me on.
You bet.